So today we're going to talk about arteries and veins. Uh, Vein problems are very, very prevalent, probably underdiagnosed because it's not something that people get excited about, especially physicians. But to patients, vein problems are an issue that really bothers them in terms of the quality of life and can really affect your normal activity level. So kind of jump into it. So when we talk about circulation, especially these kind of issues, there's two components, right? Think of this like a circuit. The circuit coming down and the circuit going back up again. The circuit coming down is your arteries. The circuit going back up is your veins. So arteries are the high pressure system that brings blood flow down to your legs. And if you cut an artery, you're going to have pulsatile flow out because it's under high pressure. Well, veins take blood flow back up, and you can just see where that could lead to a problem because veins are a low pressure system going back up. You get blood drawn or you cut a vein, you just kind of ooze out. But when you have vein problems, the veins are under a lot of pressure. So the physiology is that veins take blood flow back up. Now there's two vein systems, the deep vein system, that's the main vein system, and then the superficial system, which is the lesser system. Most of the vein work of taking flow back up is by the deep vein system, which you never see, that's deep in your muscles. And then the superficial system does the rest of it. And there's also connections between the two. The superficial system is the greatest saphenous vein, and the lesser saphenous vein. The greatest saphenous vein goes from your ankle to your groin crease, and then the lesser saphenous vein goes from the back of the knee down to the outside part of the ankle. But all these channels or plumbing should be taking blood flow back up. The problem is it's a low pressure system. When we sit or stand like we tend to do most of our lives, gravity is always fighting you, and you can just imagine gravity eventually wins. So we have one-way valves in those veins that are supposed to stop the blood flow from coming back down. When you sit or stand, as gravity tries to drag the vein blood back down again, these valves are supposed to close and stop blood from coming back down again. But these valves are very flimsy valves, completely unrelated to heart valve issues. When they get disrupted, they just don't work well. These very elastic structures, very flimsy, they get overstretched and then just don't work. And there's no medication that helps them fix. So over time, when you're on your feet a lot, especially in occupations where you sit or stand, blood tends to come back down again. And that's what leads to varicose veins, because it's almost like a cascading event. There's a series of valves that get overwhelmed, and so the more time you're on your feet, the more the blood backs up in your legs. That's why when you sit or stand for a long time and you have varicose veins, they really pop out because everything's backing up on you. When you elevate your legs, everything then drains out of your legs. So it kind of makes logical sense. But the problem with varicose veins is it can be quite debilitating in terms of the quality of your life and normal activities. So you can, have symptomatic varicose veins and asymptomatic varicose veins. And so there's a difference in terms of management. But there's no great medication for this stuff. That's the problem, because these veins get more and more distended, and you can have some issues with them that can cause you a difficulty in terms of your, say for example, at the end of the day, your legs just kind of feel achy and swollen and heavy. Or you can have issues with restlessness at nighttime with your legs. You tend to thrash around a lot. About 30% of restless leg syndrome is from vein problems. And there's different techniques for managing it. But the underlying physiology is that the more time you're on your feet, the more it tends to bother you. And so there's conservative management and aggressive approaches to varicose vein problems. And I'll kind of get into the details of that more in the next video, but suffice it to say that most vein issues do not need surgical treatment. The problem is that there's way too much surgical treatment of varicose veins happening right now. And I don't think it needs to be that aggressively managed. I'll tell you why in the next video.